Hey, everybody. I'm Yael Lehman. I'm the Senior Director of Strategic Partnerships at Families USA. I want to thank you all for joining us at All Hands on Deck, Keeping People Covered Through Unwinding, a conversation with the Center for Medicare and Medicaid Services. We're all here because we have a common goal. We don't want people to lose coverage who are still eligible for Medicaid. And so we're here to learn and ask questions and work together to keep everybody insured. Before we get started, I'll just go through a few housekeeping notes. We will be taking questions, so please submit your questions for CMS as you think of them. And what we'd like you to do is to use the Q&A feature, and you'll see the Q&A feature at the bottom menu there. We'll try to reserve the chat for a commentary and housekeeping. Also, so folks are aware, we will be recording today's event and can share the link upon request. And now I'm very happy to introduce the Executive Director of Families USA, Frederick Isasi.
Thank you so much, Yael. It's a pleasure to be here. We are very excited to be able to hold this national discussion. And as you said, as we can, each of us play a role in helping to protect families across our country from losing their Medicaid coverage during the end of the public health emergency. This is a crucial moment. It truly is an all hands on deck moment. And it is so wonderful to have so many folks. We have over 750 folks who are joining us today for the discussion. And together we really can make a big difference in the lives of millions of families. As many of you know, this is the largest redetermination of Medicaid eligibility that we've gone through as a nation. And the initial data from across the country show over 1 million people have already lost coverage. And it looks like many, if not a majority, are losing coverage simply because of the paperwork requirements, not because they're actually being determined ineligible for Medicaid. All told, the estimates are that about 7 million children and families who are eligible for Medicaid are at risk of losing coverage simply because of the paperwork. They could lose coverage because they've moved and aren't receiving the redetermination notices, aren't being contacted at the right phone numbers, aren't being communicated to in a language they understand, and on and on. And we can stop this, and we can protect 7 million people. We can protect the kids who are relying on Medicaid for their wellness visits or get treated for asthma, or the mom so she can continue to receive her postnatal care, or the disabled man so he can continue to receive the supportive services that allows him to live and work in his community. All of us have a role, whether we're the advocate, we're a healthcare provider, health insurer, community-based organization, or other concerned citizens. We can each join forces to make sure that families are getting multiple sources of support to move through the redetermination process and maintain their Medicaid coverage. A really, really big thank you to the leadership staff from the Federal Medicaid Agency and HHS who are participating today in the discussion and ready to answer your questions. This is a national video conference, and it's come together because we received comments from many of you that there's too much confusion about how each of us might be able to help protect families during the redetermination process. And as soon as we brought this concern to CMS, leadership gave us an instant yes. They really want to be a partner in this with all of us. It was really a joy to see how quickly they responded. And today we're joined by some of the most senior folks who work on Medicaid issues for President Biden. And that includes Rachel Pryor, who's counselor to the HHS Secretary Becerra. Many of you might remember Rachel from her previous role, running Medicaid in Virginia. And that included her phenomenal work streamlining Medicaid enrollment and receiving recognition from Governor Northam. We're also joined by Perry Briskin, who's senior advisor in the Center for Medicaid Medicaid CHIP Services, and she has deep expertise in the Medicaid program, having worked with insurers and in previous leadership roles with the Biden administration. And then finally, Eden Tesfaye, Eden is the senior advisor for external affairs in the office of the CMS administrator and previously worked with HHS leadership and in the Biden White House. You've all been working so hard on this issue of Medicaid redeterminations, and we know how much you want to help all of us engage effectively in protecting Medicaid families. So thank you for taking the time to be here and be part of this discussion. And so with that, let's turn it back over to Yael to lead the discussion. And for everyone participating across the country, as Yael mentioned, there's plenty of time for direct questions. So please look at that Zoom Q&A area, and you can place your questions in there, and we'll be able to get them to CMS. So with that, Yael, please take it away.
Great, thank you. Thanks, Frederick. All right, let's get started. So thank you, Rachel and Eden and Perry, for being here today. It means so much to us that we get a chance to talk with you directly. And Rachel, we understand that you have to take off a little bit early, maybe around 3:10, but thank you all three of you for being here. So let me start with the first question. You all just put out a really excellent fact sheet called Keeping People Covered as States Restart Medicaid Renewals. And actually, we're going to post that link to that sheet in the chat. And it's also been linked to all the emails that we've sent out to folks. It lays out exactly what different stakeholders can do, whether we run a plan or we're providers, we're advocates, we're from a community group, and a whole variety of folks from all those different stakeholder groups are on the line today. Could you guys just walk us through big picture, high level overview of what each of us can be doing right now?
Sure. So I can start a little bit, and I will say at the top, I'm hoping that this is one of many conversations that we can have with you all. We are on a journey, not a sprint, and we are going to need your help at every touch point, every moment. And I will say candidly, for me, it is very, very helpful to have conversations that are at the state and local levels. The rubber meets the road at the state and local level, right? Like that is where our people are, and we need you to understand what is going on, and we need to have these types of conversations so that we gain the benefit of that feedback. So I'm really very happy to be here with you all today. I think and I will let my colleagues from CMS jump in, but the fact sheet, as folks know, was released with a letter from Secretary Becerra to states about some of our expectations for our states, and also sort of reiterating our coverage is our top priority, period, end of story. We want to make sure people stay covered in whatever coverage is right for them. And we also are asking for an all hands on deck effort. And that fact sheet really lays out our story as we see it. Churn in Medicaid is nothing new. That is something that we have struggled with in this program since the get-go. And I will say that, it is, this is on a mass scale, and we have got to do better. And I think we have to do best. that's what I have been, what we have been pushing out. And I think our fact sheet was an attempt, and I hope a way to really distill a lot of what we've put out in just thousands and thousands of pages of documents, and reiterate a call to action to folks to reach our Medicaid beneficiaries directly, because we know that this is not a situation where just one strategy works. We need multiple strategies at every touch point, at every moment, at every time. People need help filling out renewal forms. They need help knowing that a renewal form is there. They need engagement at doctors' offices. They need engagements from mental health providers. They need engagements from grocery stores and Dollar General, and everywhere that we are interacting with our people, we need to take this opportunity to make sure that they know that coverage is there for them. So I think that is the point of the fact sheet, is really to sort of all hands on deck. We're calling for you, and we hope that you will join us. Perry or Eden, I don't know if you have anything to add.
Just to add another layer to what Rachel said, yes, this is an all hands on deck moment. And I think the number one thing we need from you is to help us get the word out. And so what we are seeing is that there are still, despite, we've been working on this for 2 years, but there are still many people out there who don't realize that this is happening and don't know to look out for their form in the mail, don't know to return the form. And after 2-3 years of not having renewals, it's hard to get back into that rhythm. It's hard. This process is hard no matter what. And so if we want to keep people covered, if we especially want to keep children covered, then we need to be out there letting people know. Are folks having a hard time hearing me? I'll try and speak louder and then maybe dial in on my phone, but we need everyone out there helping to get the word out. And we have, we can post the link in the chat, but we have a number of communication tools on our websites in multiple languages that are ways for people to put up flyers, send postcards, send text messages, get this on social media. So that is sort of this kind of get out the vote kind of communications campaign to make sure that people know that this is happening, know to look out for forms in the mail, know to return those forms, and everything that you can do on the ground is what we're calling on organizations to help us do. So thank you. So that just wanted to reiterate and put a, double state that.
Everything Rachel and Perry have said times a million. And in addition to that, also thinking about non-traditional partners, folks who you all may not typically have worked with before in the past, who aren't necessarily healthcare advocates or in this space, who have the ability to really help you guys get the word out. People who have partnerships like the National Action Network with faith-based communities, churches, mosques, et cetera, making sure that pastors and whatnot are talking about this, your own pastor, your own imam talking about this on Sunday morning or when you're going to whatever service you practice. And in addition to that, really trying to encourage our local government partners, your state legislators, your mayors, your city council people to also help get the word out. This is not on everybody's radar. For those of us who are in the weeds on this every single day, we are trying to do our best to reach our local government partners across the board, and they're really willing to help and wanting to be a part of this. And so making sure they know that this is something that's happening in their state, making sure that they know that there are resources that they can also utilize, that, and making sure folks know what the work that you all are doing. And I'm sure that your mayor's office would be happy to partner with you guys to do this work as it is an all hands on deck effort. And something else that I just want to reiterate that Rachel said, we are in a marathon, not a sprint, and it takes somebody around 17 times to have a message resonate with them. And so please, please, please continue to push out our messaging and remind folks that although they've put it in their newsletter on this day, this time already, they should continue to do so. And so thank you guys for your willingness to be helpful here, and hopefully we are successful here at the end.
Thank you all. Great points. We're going to need multiple strategies to make sure that people know that coverage is there for them. We really have to work on getting the word out, letting people to know that they got to look out for the form. We're working with all kinds of different partners, traditional and non-traditional, including our mayors, our pastors, our grocery store operators, and to think long-term. This is going to be, like you said, a marathon, not a sprint. We got to keep getting the message out over and over again. Another question we've been getting from partners is, for those of us that interact directly with beneficiaries, whether they're at a plan or a hospital, a community group, they were asking what specifically can they do to help people with redetermination paperwork and also enrolling in the exchanges.
So I can start and then kick it over to my colleagues. They can do a lot, right? So just a couple of things to be aware of. We do have guidance documents on our website about how to support somebody to enroll in Medicaid. We also are funding navigators on the ground through our marketplace as well. Another thing I want to mention is that we issued a new flexibility this week in the Secretary's letter where Medicaid managed care plans can actually fill out the renewal forms. One thing that's really important is to get your state to take up some of these flexibilities. So it's really important to be advocating at the state and local level to make sure that, we always, you need the state to kind of, sort of bless that support. But I will say, just a fun story. When I was in Virginia, I remember I had to go to the ER for like an eye issue, and we had just rolled out Medicaid expansion in Virginia, and I was sitting, and there's nothing to do in the ER, as folks know. And I was just sort of sitting there, and I overheard somebody talking about how there's no health insurance. They didn't have any health insurance. And I was able to just, now granted, I knew a fair amount already about Medicaid renewal, or Medicaid enrollment, but I just sat with the person, went to our Cover Virginia website, sat with my colleague or with my friend I had met in the ER and said, let's enroll you right now. And went through and helped them understand the form. Sometimes it's just having someone to talk through it with you, but really thinking about if you think you can be a navigator or you can offer navigator supports, hospitals, pediatrician offices, Doctor's offices, primary care, FQHCs, great partners to go to and say, I think I can offer this service. Let's talk about how I can do that. The other thing I wanted to flag is that parents, we really need specific messaging to parents. I think the message is getting out there, but you know, a lot of times, even if a parent isn't eligible, their child still is. And so we really need folks to sort of fill out those renewal forms no matter what. You know, daycares, great partner, great place to be, right? Head Start programs, home visiting. So just, you know, I think one of the things that has been really effective is when advocacy groups are able to sort of partner with the FQHC association in the state, the local AAP chapter, and say, you know, do you have patients that are getting renewed for Medicaid? Let me be in your office one day a week, and I can sort of, you tell me which beneficiaries might need some help with renewal. We'll set up shop right there. That's been something that I've heard about a lot that's been really, really effective. So I think there's a lot of ways to do it, but creating those partnerships and kind of planning yourself there, I think there is no shortage of somebody who's going to be willing to take that assistance.
That's great. I don't know, Perry or Eden, if you wanted to add anything to that.
I think what I would add is, you know, we are at the federal level, but states have their own operations as well. And I know many states have their own stakeholder calls, have their own engagement. So if you aren't, depending on what state you and your organizations are working in, I would definitely make sure to be aware of what's going on at the state and what kind of outreach they're doing, and to plug in there as well. But as Rachel said, I think there's an infinite number of ways people can get involved and help people help do the communications outreach and help people with renewing their forms. And Eden, did you have something?
I just wanted to echo everything Rachel said, and then also, you know, going back to the churches and mosque and synagogue and all that, those are great spaces where folks go to have questions like this and conversations like this. And so making sure leadership at your church, at your synagogue, understand, know what their rules for their state are, and what folks need to do in the area that they live in. That way they can help communicate that even if you aren't there or somebody who is a navigator is not there. And that way, as many people as possible is getting that same information. So just really, really want to echo Rachel's point.
Great. All right. We really do want this to be an interactive conversation, and Rachel and Eden, I realize you both need to drop off a little bit early, but Perry, you're going to hang in there with us, which we appreciate so much. I'm going to pitch the first question from the audience. So one person asks, in the states I'm working in, I'm currently seeing beneficiaries are losing Medicaid coverage that have SSI. When they reach out to the SSA, they direct them to the state. The state is redirecting them to SSA. Is there any information why this is happening? SSI specifically talked about in the state's plan for unwinding. Any thoughts or direction?
I can take that. That sounds extremely frustrating, and I think there is some miscommunication between the agencies, and that you are not the first person to raise this issue. I think it should be easier. There should be some auto enrollment if a person has SSI for their Medicaid to be renewed. I will put my email in the chat, and you can send me an email and we will try. It would be good to hear what state you're operating in, and we'll try and get you a clear answer on it. But yes, that ping-ponging shouldn't be happening. So.
All right, next we'll find out what state that person's from. All right, next question from the audience. Could you discuss how we can track redetermination progress in our states and identify specific challenges and things falling through the cracks?
So I can start a little bit, and then I think Perry will have lots more to say on this. We are tracking. We have a pretty aggressive oversight and monitoring engagement right now with all of our states. That data, and the work that we're doing is not it's more behind the scenes. It's not generally publicly available yet, in part because the way, when you're validating data and looking through data, you have to sort of know what you're looking at first, make corrections, go back and forth with the state. That process sort of has to happen on our end. I think, a lot of the states that I'm seeing are posting their own data. And so I would just put that out there. I think it's important to be connected with the state Medicaid agency because there is a lot, for instance, I keep saying in my previous state of Virginia, they have a dashboard, that is public where folks can go. I think there are data drops, every month pretty much from each state. So I think that's one important resource to sort of know what's happening on the ground in your state. And then I think in terms of those partnerships, a lot of times data says one thing, but we have anecdotal stories like the SSI story, for instance. Those are, those are incredibly important. A lot of times there are, data will give you a bigger picture, but it's the sort of specific stories that you hear about that you can go run down and realize something not right is happening here. Like we need to investigate this further. So I would say both points are very valid and very helpful to us to hear about.
Thanks, Rachel. All right, next question. Can MCOs help members complete both renewals and applications?
I can take this. The flexibility that we put out last week, times the flat circle last week, it is just for renewals. It's not for new applications at this time, but it is for renewals.
All right.
And I can put the link to that where I'm reading that, just so you all have it.
Okay, perfect. Really appreciate that. All right, next question. Can navigators help virtually, phone or Zoom, using electronic signature?
So this is where the silos of CMS show. I'm a Medicaid person on Navigator. Rachel, do you know the answer to that question?
So on the tech, on the electronic signature, in part because it is a highly legal thing, I'm going to ask that Families USA make sure that we get that question and we take it back. On the support electronically, yes. On the actual signing of the application, I want to take that back because I think it actually differs state by state and whether it's an SBM or an FFM. So we will take that one back.
Okay, got you. We're on it. Okay, next question. Several times now, Unwinding has been described as a marathon, not a sprint. I myself just said that 2 seconds ago. Many states are actively taking the opposite view. CMS has enforcement authority to ensure that states are not excessively disenrolling or rushing Unwinding. What factors will CMS look for before exercising that authority?
I'm happy to try and take that one. So the CAA last year, the budget bill at the end of last year, gave us the authority to take certain actions if a state is in violation of federal requirements or new data reporting requirements laid out. If we find a state is in violation of federal requirements, we will take action. There is unfortunately in the statute not a requirement that states take 12 months to renew, even though we have been strongly urging states to do that. What we have found is that states, in order to stay eligible for their SMAP, for their increased federal Medicaid funding, they need to follow certain rules, and including states have some mitigation plans, they need to follow their mitigation plans. And when we inform states that they are not in compliance and that they may lose their FMAP, states surprisingly jump to moving quite quickly. So we have found that is most effective and most quick compared to the corrective action plan, which is in the CAA. That can take a little bit longer, or asking a state to pause procedural terminations, which is also in the CAA, that can take 1 to 2 months. And so we are looking for things to move the quickest and what levers we can use the quickest. We are publicly urging states to take up to 12 months, and we cannot require that. That is not part of our authority, but we are urging it, and we're looking closely at those states. So when they do release numbers that are concerning, we are diving into those states to understand those numbers, understand are they meeting the minimum federal requirements. If you are advocates seeing on the ground that your state, you believe, is violating federal enrollment and eligibility requirements of Medicaid, we want to hear from you. We want to hear what you're saying, and we can investigate. We are investigating with states. We are looking at the data that's coming out and looking into it. But we need your help in keeping an eye on these states for us. But we are doing that. But the key to the action that's taking is, are they in violation of federal requirements? But we also continue, we have to go beyond those federal requirements. Those minimum requirements we see in the data are not enough, and we are doing everything we can to go above it and beyond those. And Rachel and Eden, anything to add there? I know this is a question that's on everyone's minds currently.
I think the only thing I'll say is that to Perry's point, compliance is a serious thing. We will not hesitate to use our compliance levers when we need to, period, and end of story. Like we are happy to get out there on that. If we see a violation of federal Medicaid law, we will take action. And the secretary has been very clear about that. He wrote it in his letter to states. There are no ifs, ands, or buts. The second piece of this is there are many, 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 many things that we wish and hope and urge our states to do that are just good practice. It's a good way to do this. It's a good way to do unwinding, and it's going to be the best way to do unwinding. We need to do both of those things. Urge states to get on board with the strategies that CMS has put forward that we think are going to make unwinding go better. And, at the same time, have a really strong monitoring and oversight structure in place so that if we see a violation, we can go after it.
That's great. On the other side, or in combination, I guess I should say, is there anything that we need to be doing as advocates to be pushing our states? If we're a plan, a hospital, a community group, an advocacy group, are there things that we can do to help push the states that will all help all of us get in there to the maximum and help as many folks as possible?
I think that, there are a couple strategies that the secretary laid out in his letter in particular. We've released dozens, candidly, of flexibilities that we think could make a really big difference and sort of drive home this idea of kind of minimizing procedural terminations and minimizing red tape for beneficiaries. But he also called out a couple things that are just good things to do, right? So take the full 12 months, don't rush this, really be thoughtful. You've got 12 months, you've got even, take the time, right? Take the time to do this right. And he kind of listed a couple others. And I think that that's really where, number one, I think Perry said, watching and letting us know if you see something that's not right. We can't do that. We're not on the ground. We can't see it. So unless you tell us, we might not know. So that's point number one. And point number two is really urging states, to take up the flexibilities that have been outlined, in the secretary's letter. And then, I think at this point, thousands of pages of guidance that Medicaid has issued to really, make this process go better than it would under, sort of current state if a state doesn't take up any of those options. I lost her. Did anyone else lose Yale?
Yeah, I can't hear Yale anymore.
Us too, yeah.
I lost you,
And I
Yale.
know, or Eden, I know you have to drop.
Yes,
I do.
We can wait. Yale, can we hear you?
Just wait.
There we go. Nope.
I will just say that while Yale is getting her audio together, I am sorry that I have to drop here. And Rachel, I know you do also have to drop, but I wanted to just stress that this is one of the administrators. I don't want to speak for Dan. but I hear him talk about this every second of every day as well. Our CMCS directors, one of our top priorities, if not the toppest priority, the number one priority rather. And so we are working to do everything that we can to ensure that as many folks remain covered and have coverage. And so we can't do this without you guys. And just thank you from the administrator to all the folks here at CMS for your efforts. And we look forward to continuing to work with you all. And wanted to also just turn it over to Rachel to see if she had anything she wanted to say before she drops as well.
Yeah, I'll just repeat sort of what I said at the top of the call, which is that I hope this is one of many conversations we can have with you all. Open door here at HHS CMS. We need you very much, and we need you very much. So we are happy to sort of be able to engage with you today. I hope we can keep engaging together, appreciate the work that you all are doing on the ground to keep folks covered. It matters. So thank you very much. Appreciate it, and was happy to be here with you all today.
Thank you so much, Rachel and Eden. And thanks everybody for dealing with my technical issues. It seems like every time something's got to happen, right? So Perry, it's you and me now, just the two of us, which I think is also a really great song. All right, so here's a couple more questions coming in from the audience. To what extent is CMS engaging LSC, for example, through an interagency approach? Legal aid lawyers are able to work on the more complex aspects of the redeterminations, but not every healthcare organization or provider has a medical legal partnership. Raising awareness is one challenge. Getting people over the more complicated aspects of coverage may require legal expertise. Is there anything that is or can be done to help facilitate an interagency approach?
So we at the federal level are doing this. We are working with our colleagues at DOJ, who I believe, help support legal aid around the country. We're partnering with the Department of Education to reach schools. We're partnering with USDA to make sure SNAP programs and WIC programs and free and reduced lunch programs all know that this is happening and that everyone is working together. If there are organizations like LSC, which I believe is a private organization, that it would be helpful for CMS to come speak at and share this information. I put my email in the chat earlier. You can email, and we're happy to come and speak and answer questions similar to this. So we are definitely, that is on our radar. We've also been looking at working with employers and labor unions. We know that there are a lot of companies that hire workers who use Medicaid, or maybe they had the opportunity to switch to employer-sponsored health insurance, but they need to make that transition, or they're eligible for Marketplace. So we are definitely trying, and Eden mentioned this earlier, talk to people who we would not normally talk to about Medicaid and bring them into this effort. So again, just welcome. That is on our minds. We are doing it, but welcome, comments and feedback on if there are areas that you think or organizations you think we should be talking to, we aren't. Would love to get that email, and we would be like to reach out to them.
Wonderful. Okay. Will CMS start posting 8th of the month reports from states about disenrollments? Our state Medicaid agency won't post them.
Yes, can we ask what, I guess we don't know what state that person's from. I know a lot of states are posting their data on their own in the early part of the month, and that is part of, we encourage states to be transparent with their data. We are being sent data, and we are in the process of reviewing and cleaning and making sure that state data can be compared apples to apples, as they say. We will be releasing our first data report, I think, later this summer, we think next month. And so that will be a time where we release all the state data that we are receiving. So we will be releasing state data. But just so you know, just so everyone knows, like, as we are getting in data and saying things are concerning, we are not waiting for us to publish public reports to act. We are acting immediately when we see things that are concerning and digging in with states immediately. It just takes a little bit of time. For instance, we received data from a state where there were too many zeros, or another data where there aren't enough zeros. And we don't want to be, some people are like, why is it taking CMS so long to release this data? And, you know, we want to make sure that what we're putting out is accurate and useful for people. And this is, some of this data isn't data that we would normally collect. This is sort of, some of it is new data, for instance, the call center times and things like that. So data is coming from CMS. It is coming probably later next month. And then we would encourage, you know, you to, if your state is not posting data, although we know many are, if your state is not posting, we encourage, that can definitely be an ask of your state, is to get them to publish their data.
Got it. Okay, thank you everybody for posting all your questions. This is awesome. And Perry, this is really, really great that you're rolling with us and giving everyone a chance to just ask the questions that they're dying for answers for. Okay, here's another question. Is there an explanation for why a state's monthly unwinding data report shows zeros in the quote renewals and outcomes section? This section should share how many terminations and renewals were completed.
So I would need to know, I'd be interested to see like what particular state, or be able to see the chart. I will note one thing. We know that states are renewing on different timelines. So if this is a state who's maybe not initiating any terminations or renewals until July or August, we know that some states, so that would be just off the top of my head. If you're seeing a lot of zeros where there should probably be numbers, it's maybe the state hasn't started yet. But that's a good question, and you could send me the note. I know on our website we have, and I can try and post the link, a list of when states are starting their renewals, and we're about to update that. Do you know, oh, my state started renewals in May, or my state started renewals in July, so you can know when to start to look out for that termination data.
Okay. And like we said, we're recording the session and we will follow up with folks about some of the questions too. All right, here's another one. Can you talk about the 90-day reconsideration period?
Yes, so I believe this is when a person is terminated from their Medicaid, they have 90 days to, I believe, to appeal and get reinstated without having to submit an application form from scratch. Something that we tell people is everyone should be submitting their renewal form, even if you miss your deadline, because you could still be in that 90-day period and your application could still be processed. You may lose coverage for maybe 30 days, but you can still be, you don't have to start from scratch, which is a different process. So that is one thing we're telling people is fill out your renewal form and return it. Even if you think, oh, I'm a little bit late, if you're within that 90 days, you can still get reinstated. So that, and so, yeah, I can find more information about that, but that is, I hope that answers the question, but there is something important about just return the form. Like, we want parents to return the form, even if parents don't think they're eligible, their kids are eligible. It's usually one household form. So we're seeing that a lot too. So it's just sort of, it's return the form, return the form, return the form, return the form. That is the message.
All right, got it. That's really good to know. That's really, really good to know. Another question. When states have a very old attestation of income, but a current data match showing income of 133% FPL or less, can they rely on that to make an ex parte decision, or do they need to get a 1902 E14 waiver?
So very good question. So that is state to state, what states have chosen to take up for ex parte. So ex parte, for those that are not familiar, and I'm going to post our E14 website. So E14s are waivers that states can get to make it easier to auto enroll individuals based on other existing data sources. And we are pushing states to increase what's called their ex parte rate. So the percent of people who can be auto re-enrolled. because the more people that can be already enrolled, that means the fewer people that have to submit forms. They don't have to resubmit data that the state already has through another data source. Many states have taken up these E14 strategies, as we call them. And in that link I just posted, it shows how many and which E14 strategies your state has taken up. There are some states that have taken up a lot, like 5 or 6 or more of these strategies. There are some states that have taken up 0. There are some states that have taken up 1. For all of those states that have taken up either 0 or very few E14s, we are calling on those states to take up more of them and to talk to us. And it's something that a state has to implement, but we are making that, submission and approval process as quick as possible. But one thing we are saying, if a state has high terminations, we can't require states to take up these E14s, but when we see high procedural termination rates, we can be like, okay, how many E14s, what E14s have you not taken up? What things have you not done already to make it as easy as possible? So, or what are the other strategies that you've taken up? So I think the ex parte rates, the ex parte strategies vary from state to state, but that's something definitely you can look for and advocate for in your state, is look at that E14 table and say, okay, what is my state doing? What is my state not doing that other states are all doing? And should I push my state to take up more flexibilities that we believe will keep people covered? And that's often, really effective. These are like system improvements that should be done probably no matter what, and are probably going to be, if you think about it, probably have a higher impact than, a billboard on the side of the road kind of thing. So yes, thank you for bringing up ex parte. It varies from state to state, but look at where your state is and encourage your state to take up more strategies.
Okay, great. And now I know how to pronounce it. All right, so here we go. You know that moment when you read something, you're like, I know I'm not. Okay, here we go. Here's another question. Can you describe any requirements for employers about granting an SEP for their plans for those who lose Medicaid?
Yes. So I think we are asking employers to do an SEP, a special enrollment period, for people who lose Medicaid. We know that some employers, we are also, I think, putting out shortly, CSIO, our marketplace counterpart, is putting out a tri-department letter to employers to clarify for them everything that employers can do, which is not just hold a special enrollment period, but extend the special enrollment period. So maybe the special enrollment period, the 60-day or 90-day, it's not long enough. So we are working on that. We'll be putting out an additional letter shortly. And I can also make sure after this call to send around what guidance currently exists for employers. I think the Department of Labor put out an FAQ on unwinding for employers, so I can make sure that everyone gets that here.
Okay, that's great. All right, guys, keep them coming. This is awesome. Next question. When states have here we go. Can you, say more about the operational details of the new flexibility letting pharmacies, community groups, and providers extend presumptive eligibility for people whose Medicaid ended procedurally? For example, a pharmacist may know only that someone's Medicaid ended, but the pharmacist won't know whether the termination was procedural. And what mechanism can be used to ensure that the person with presumptive eligibility transitions to ongoing coverage?
Yeah, so this is one of the new flexibilities that we released last week, and we're very excited about it because we know that there are a few places where people may not even realize they've lost coverage. They show up at the doctor's office, they show up at the pharmacy, and it's at that moment where they realize, oh, you have no more coverage to pick up your meds or have this appointment. So we know that those are some crucial touch points to meet people where they are and re-enroll them if possible. Presumptive eligibility is where the person, whether it's right now, it's often in, hospitals and healthcare providers, but like say you're at the pharmacist and the pharmacist can look in the system, see that you were terminated, and just presumptively enroll you in that moment so that you can get your medication and have it covered at that point of service still. So that's why presumptive eligibility is great and really important. I will be frank, this is new. We are operationalizing it as we speak. And so talking with states about how it's going to work, it'll probably work a little bit differently in states. So I think stay tuned for that of how it can work. But I know on the pharmacy side, we're still talking with folks. But yeah, it's a workflow issue. You know, you're in line for the pharmacist. How do they do that quickly? Does there need to be a separate line for it? All of those types of things we're trying to work through as quickly as possible. And so this is also a moment where this is a new flexibility for states. So states need to come to us and then we help to operationalize it with them. So there isn't one way to do it, but I would definitely be in touch with your states and pushing them to take up that flexibility if they haven't considered it yet.
Okay. Right, a terrifying moment. You're at the pharmacy and then you find out you're not covered when you thought you were. And so important for all of us to push the states to make sure that this flexibility is offered to folks. Okay, next question. I have noticed that my state, Connecticut, is not sending notices to people who may no longer be eligible for Medicaid due to income increases, and people are finding out they lost coverage once at a doctor's office or picking up a prescription. This is a perfect question after what we were just talking about. Can you speak to what responsibility states have in communicating coverage loss in a timely manner in this scenario?
So states are required to, part of our federal, so this would be a good example of something it sounds like the state is, if this is in fact true, the state is not following federal regulation. So states are required to notify someone that their coverage is about to be terminated and offer them something that's called a fair hearing, which is basically an appeals process. So if people are getting 0 notifications in the mail, then that is a concern, and that would be something that could warrant us reaching out to the state and possible enforcement action. So my email's in the chat, send an email, but again, the more specifics, the better, of who wasn't getting it, when did they expect to get it. I will say the one tricky thing about unwinding is that it's happening over 12 months.
Yeah.
A person who is up for renewal can get a notification at any point in those 12 months. It sounds like in this instance that wasn't the case, because it sounds like the person lost coverage and got 0 information in the mail ever. You know, if a person hasn't received a notice in the mail, it doesn't mean nothing has happened. It may mean they're up for renewal in October or up for renewal in January. So it's definitely a hard message to communicate, because the message is look out for the mail, and the mail may come anytime between now and, you know, early next summer. But let us, you know, email us about that, and we'll, you know, that sounds like something that there's something not okay there.
Got it. Okay, here's the next question. Do you have any recommendations for states that are also going through Medicaid expansion? Is it possible for the state to temporarily pause unenrolling people until expansion enrollment begins?
So I know that this is a question in some of our expansion states. South Dakota is about to implement expansion. North Carolina has passed it. Partially, I believe North Carolina still has to pass a budget to approve expansion, maybe. But anyway, I think I would have to take that back. I think the answer might be no, but I know that's something we have been discussing with folks. So I would have to take that one back.
Okay, we'll make sure to put a little star on that, and we'll get back to folks on that one. Okay, Perry, thanks for being such a great sport. I'm just throwing them at you, and you're just taking them one by one. We really appreciate it. Okay, here's another one. Advocates have raised some concerns about MCOs conducting renewals. What are the guardrails?
So we have a new flexibility where MCOs can fill out certain parts of the renewal form. An MCO can't sign the form, do the final, signing of the form for the person. They can't do it entirely without the individual. So there are some guardrails there. I would encourage you to email us for more information. But we are hoping it's something where they can help fill out a good portion of the form, especially with information that I think we'd all be happy for them to fill out. So you can email for more information, but there are guardrails and they can't do it entirely themselves or without, the consent or visibility of the individual.
Got it. That makes sense. Okay, you ready for the last one, Perry? Here we go. Is CMS considering relaxing Medicare SEP documentation requirements for unwinding so that folks who lose Medicaid without knowing it can enroll in Medicare without needing to prove Medicaid termination on or after January 1st, 2023? Self-attestation to loss of Medicaid is accepted for Marketplace SEP. Medicare enrollees are equally, if not more vulnerable to procedural denials, which are already happening on a large scale.
I would have to take that one back. I know there is a Medicare SEP. I don't know the details. I would need to take that one back.
Okay, we'll put a star on that one. We will get back to folks, we promise. Okay, well, Perry, I did want to we do just have a few minutes before we're going to wrap up. And so I did want to just take a minute. I wanted to make sure you had an opportunity to say or reiterate any last points that you wanted to make to the group that's here today before I say the last words and we wrap up. Is there any last thoughts or messages or ideas that you want to share with the group today?
Yeah. I'll just say first, thank you. I know you all have been doing so much work on the ground. I think I saw this somewhere in the chat, but someone's like, we have been working on this for 2 years, and we know we have all been working really hard for 2 years. And I think it's hard to see the counterfactual of like, had we not done the work, what the numbers would be. But no matter how hard we work, it's always, we are always concerned when someone loses coverage, especially coverage that they are eligible for still. So we will continue to work really hard, and what we care about is people getting into coverage. It doesn't have to be, if it's Medicaid, if it's Marketplace, if it's Medicare, if it's employer-sponsored insurance, what we care about is people staying covered. And so all of these questions are great questions. And if you send them to me, I will just say specific examples are the most helpful. So if you have a specific state, a specific MCO, a specific case, and you can flag that, or if you have a group of cases, we know that a lot of our national advocates are also soliciting, whether it's Families USA or Unidos or others, we also welcome to sort of, if you collect everything and send it in one batch and show us what you're seeing on the ground, that is what is most helpful at the federal level. So thank you in advance for sending all of that up. And we're also, I will say, also receptive if we put a lot of materials, a lot of information online, but if there's something that would be more helpful that you have not gotten, or if there's information that you feel like you should be getting from your state that you are not getting, share that with us too. So we're trying to have this be as much of a collaborative dialogue to help keep people covered as much as possible. So thank you. And yeah, continue to please get the word out to people who may be losing coverage.
Thank you, Perry. And I just want to say to everybody, thank you all for attending as we work collectively to keep everybody covered. This was a wonderful opportunity to talk together as a community about, we all care about people who rely on Medicaid for their health insurance. The work is ongoing. It's something that we will come back to as the year continues. And I just want to say thank you to all of you for your hard work to keep folks insured. And a huge thank you to you, Perry, and also to Rachel and Eden, who were with us earlier, and all the folks at HHS. Thanks, everybody.
Thank you so much for having me. Thank you, Yael. Thank you, Melissa. Thank you. Take care.
Okay, take care.